The AVPN philanthropic funds are very important to the community, to both the funders as well as the grantees, because we are facing an unprecedented crisis in Asia. There's a need to deploy funding fast, but the question is to whom and how can we amplify the impact of our work?
You often see emergency responses, taking away a lot of bandwidth from people who should be focused on the response just because, the help that arrives is so splintered, often very duplicative.
The lack of proper infection prevention and control practices and preparedness, which, as we have all come to realize, is crucial for protecting our communities. In particular, smaller and remote health facilities struggle the most in this aspect due to the limited availability of resources.
We are very happy to be able to bring together 6 funders to support solutions pertaining to healthcare needs as well as COVID response and resilience in 4 Southeast Asia countries: Thailand, Philippines, Malaysia and Indonesia. So by having different funders come together for the food fund, it allows us to work together and to break down silos, and we are seeing really different types of profiles of funders coming together. Organizations do not have to start from scratch, and more importantly, it's a learning journey for everyone.
The more you work in philanthropy, the more you recognise and value the lens that other kind of funders have and how they look at the same situation and the same kind of grantee and the same kind of broader challenge in particular kind of context. And that learning is priceless.
Personally, I just think it's a really interesting way to engage. And so often we are operating a little bit insularly, in our own organisations, and you're trying to get things done and, caught up often in your own activity. And it's really great to have the opportunity to just step back and hear from others about what they're doing, to, as I say, kind of benchmark yourself informally against where you're up to. If we take this fund that we're a part of, as an example, we can kind of apply it. We can take some of the lessons from that and apply it to other philanthropy.
Understanding that providing unrestricted funding is very important, not just for the grantee organizations, but it's very important for the funding community to consider a different model of working that can amplify their impact, to recognize that together, once we understand that we are moving beyond projects, we are really supporting these organizations to be more resilient. If we invest in such a model, it will help us to build the ecosystem faster, it will make it stronger, and together we will be able to create more impact, and we are able to truly mobilize capital towards impact.
With the additional funding from AVPN's philanthropic pool fund, ISE will be able to maintain and strengthen our primary healthcare systems to mitigate the effect of COVID-19 on the treatment of other diseases, as well as effectively respond on COVID-19 pandemic through infection prevention and control in refugee camps.
We try to have grantees at the forefront and grantee kind of well-being and enabling them to do their job better. And collaborative philanthropy facilitates that if it's done well, because it reduces the burden on grantees to host multiple applications to multiple partners to have one kind of more streamlined reporting mechanism.
The grant will add fuel to the already established PSC transformation program in West Java. The target is to achieve a transformed and strengthened health system that is feasible, cost-effective, equitable, culturally appropriate, and correspond to the community needs.
This is only the beginning for the AVPN philanthropic funds. We need to be able to gather more support, to have more funding to support the impact organizations doing very great work on the ground.